Good afternoon, ladies and gentlemen. I'm Peter Kovac, and I'm pleased to welcome you on behalf of the Rumi Forum to this program to discuss a question on all our minds these days and heavy in our hearts. I'm very pleased to welcome our speaker, our announced speaker, Mr. Metin Çetiner, who is the Vice Chairman of Kimse Yok Mu, and he is specifically in charge of Protocol and International Relations. Mr. Çetiner has a very interesting background in literature. He is a graduate of famous Boğaziçi University in Istanbul and taught abroad, was a headmaster of an international school in Romania, I've just discovered, and 5 years ago joined the organization. With him is a very distinguished and volunteer who is a surgeon and has worked for Kimse Yok Mu in Somalia, as we heard earlier. This is Dr. Artesh, and he is also an Istanbul University graduate, actually. And he's been an assistant professor of medicine. And as I say, he has recently been volunteering as a surgeon for the organization. So without further ado, let me give Metin Bey the floor.
Thank you so much. Good afternoon, everybody. Welcome to our program. My name is Metin Çetiner. As Peter mentioned, I'm the Vice President of Kimse Yok Mu humanitarian aid organization. And let me start with the name, what it means. Its meaning is anybody there to help me? And maybe you remember, in 1999, there was very big earthquake in Istanbul, and people, during the earthquake, people were requested help from the other people by saying this sentence: Kimse yok mu, kimse yok mu? Is anybody there to help me? So it is very meaningful name for a charity organization, so we like our names a lot. And let me start with the history. After the earthquake, people, as you know, after the disaster, everywhere it's happening, people are being needy after the disaster, so they are trying to find some solution to their problem. So it happened in Turkey in 1999 as well, and they knocked the door of a TV channel, Samanyolu TV channel, and they decided to start a TV program. It was a live program, and they invited the needies to the live program, and the audience connected to the live program and try to find some solution. For example, one of the audience, okay, I will pay rent for this needy family for a year. Another one, okay, I will buy furniture for this family, like that. And then in 2004, we established this institution apart from TV management. So we are just 9 years old, I think I can say. So January 17, 2004, that's our birthday. So we are just 9 years old. Why I'm telling you this? Because you should compare with other 9 years institution. So if you do this, you will see that really during these 9 years we did a lot in Turkey and in abroad. Let me share what we did in Turkey first. First of all, we have 81 cities in Turkey and 41 branches we have. And we have 270,000 registered needies in Turkey. And in abroad, we have humanitarian aid activities in 97 different countries. Also, to reach to this amount of country, also, I think it is very important within a very short time. Within 9 years, we reached to 97 different countries. Also, we have consultative status by UN Economic and Social Council. Also, I want to share this with you. Our mission is, while we are helping to the needy, we are not checking the religion, we are not checking the ethnicity, race, whatever. Our criteria is the needy case. For example, after the Hurricane Narcissus in Myanmar, we helped to the hurricane victims. After the earthquake in Peru, again, we helped to the earthquake victims. After the earthquake in Haiti, Personally, I've been in Haiti 3 times, by the way. So we help to the earthquake victims in Haiti. Of course, we organize some humanitarian aids in some Muslim countries as well, in Turkey as well. So this is very important for us. And also we have another very important speciality. We are inviting our donors to our events. So this is also very important. If you are a donor, when you donate some of your money, you may think that, oh, I donate my money, what they are doing with my money. You may think like that. But if you participate to the event, if you see, if you observe what they are doing with your money, after that you will raise this question mark. So this is very important. So that's the reason why we are inviting our donors, our volunteers to our events. For example, 2 years ago, I was in Uganda for Eid al-Adha activities. You know, as Muslims, we slaughter cows and sheep, and we make meat packages and distribute to the needies. For example, 2 years ago, I was in Uganda with 300 volunteers. So we distribute 35,000 meat packages in 15 different locations. So the following year, they are sharing these information with their relatives, with their friends, and so we are increasing the number of volunteers, number of donors, and amount of donations as well. So we have some categories of aids. One of them is disaster aid. God's sake, but it is happening everywhere in the world. Sometimes earthquake, sometimes flood disaster. So after the disasters, we have a search and rescue team. We are sending our search and rescue team to the disaster area. And first we are organizing some emergency aids. And then we are checking the budget, what we have, and then deciding to have permanent aid. For example, I mentioned about Myanmar. After finishing the emergency aids in Myanmar in 2008, I think, so we construct a school and donate to Ministry of Education. By the way, we are the first NGO in Myanmar who entered the Myanmar. We are the first NGO who entered the Myanmar. And the second category is health aids. We have a lot of health activities in Turkey, in Syrian refugees also, and in African countries and everywhere, especially after the disaster. Also we have medical team, voluntary medical teams. We are sending our medical teams to the disaster area. And Dr. Tarık Artaş is one of them, and he had been in Somalia after the drought problem 2 years ago. So he will share his experiences with you. And educational aids. We have scholarship to the students in Turkey, and also mainly in drought problem in those African countries, Somalia, Ethiopia, Uganda, and Kenya. So we brought 622 students from those countries to Turkey for high school and university education. And as Kimse Yok Mu, we are giving scholarship to them, and also we are buying return ticket, and also we are donating summer and winter costumes. And also they are attending to private schools, and the cost of this project is more than $50 million US. We have family aids. As I mentioned, 270,000 registered needies we have. Also, we have feast aids. We have 2 religious events in a year. Ramadan, we are and 400,000 people in Turkey from Syria. They are refugees, but our Prime Minister said that they are not refugees until the end of this problem. They are our guests. So we are naming them not as refugee, but as our guests until the end of this problem. 400,000 of Syrian refugees, let me say sometimes refugees, sometimes guests, so sorry about it. So 400,000 Syrian guests, 200,000 of them are in governmental camp. Another 200,000 of them are out of the camps, because we have the capacity of 200,000 in our governmental camps. Our Turkish government is still constructing some new campus, but when they finish, they will take the new guests to the camps. But those 200,000 guests in governmental camps, really their conditions are good enough. I heard this sentence from some Syrian people in Turkey. I hope this problem, this tragedy will finish in a very short period of time. But when this problem finish, some of the guests from Syria, they don't want to go back to their country because their conditions are good enough in Turkey. So this is very important. They don't want to go back to their country. Make empathy. How they happy in Turkey. So in out of camps, we have the problem in out of the camps, Syrians. So some of them rent houses. Some of them are staying some friends' houses, some relatives' houses. And also, let me share this also. There is a city near Syrian border, Hatay Yaylada. The name of the town is Yaylada. I have been in Yaylada and visit some friends, some Syrians in Yaylada. And also, I observed that some Turkish people who live in the village in Yaylada, they gave one of their room to the guests from Syria. And also, they shared what they have as food, as costumes, as what they have. So this is also very important. Generally, people knows Turkish hospitality in Turkey, but also when we have this kind of problem, also we are doing as our best. This is also very important. And Turkish government spent until now 30 million US dollar to this problem, to this tragedy. And also as Kimse Yok Mu, we spent 16 million US dollar to our guests from Syria. And let me summarize what we did for Syrian guests in Turkey. For example, we have mobile kitchen. And for 8 months, we are distributing hot meals for as lunch and as dinner. Before, we were distributing to 1,000 Syrian guests lunch, another 1,000 for dinner. But now we increased to 2,000 lunch, 2,000 dinner. For 8 months, we are distributing hot meals. So this is very important because make empathy. You went to another country with your trousers and with your shirts. When I visit the area for the first time, it was last summer, and they came with trousers and shirt to survive, just to survive. They left what they have in Syria. And then sometimes my friends, I'm living in Istanbul, by the way, I was sharing this with my friends, with my colleagues, and in some meetings with the guests, they were asking me what they need. I was telling them, make empathy, you will understand what they need. Make empathy. You went to another country just to survive, with the trousers, with a shirt. What you need? They have the same thing. They need everything. So, but thanks God, we finished the winter now. The weather is good enough. At least very cold weather were in the past. Now we distribute so many costumes, winter costumes. And also at that time, some people were living at the street, at the park, without having anything. So we construct prefabricated restroom and bathroom. This is also a need. This is also a need. So we construct prefabricated restroom, bathroom, and playground area for the kids. So this is also very important. Lot of kids are at the street. Lot of people are at the street. There is no activity. Just sitting, talking. So also they need something. So we distribute tents, blankets, mattresses, and also we organize a learning center. This is also very important for the kids and for the parents as well. They are having their education in their curriculum, and also we are teaching Turkish language, because to communicate with the Turkish people, it is very important to know Turkish. So also they started to learn Turkish. For the parents also, we organize some Turkish language courses. Maybe again we have a lot of things to share, but now I want to give the floor to Mr. Tarık Artaş, Dr. Tarık Artaş, to share something with you about African health projects and also maybe the Syrian refugees in Turkey. Yeah, thank you.
Thank you very much, and hello to everyone here. Actually, I'm a transplant surgeon. I trained in New York City, and I returned my home country, Turkey, and I became a volunteer of Kimse Yok Mu for a couple of years, and I've been working with them in my vacations, basically. So actually, my special field is Africa a little bit, but I can mention a little bit about, as a complementary to Mr. Çetiner, about the Syrian refugees, what we are doing as Kimse Yok Mu in that region, and at the end I can mention a little bit what we are doing in Africa. As he mentioned, half of the refugees are being trying to be cared with the NGOs, actually, not the government, because there are too many people at the streets and parks, and who doesn't have anything anywhere to live, actually. So as NGOs, and specifically Kimse Yok Mu, there are refugee camps also. So besides the other needs, actually, as medical services, we are trying to give ambulatory medical care to the people over there, especially for the women and children. We are doing basically the primary care for them. As something complicated that we confront, we collaborate with the state hospitals. All the medical services, besides the NGOs, in Turkey for the Syrian refugees are free. I mean, even for the major surgeries, complicated cases are being taken care of. Even in the region, if it is not, it cannot be done in that region, regional hospitals, they will being carried to the major cities like Ankara and Istanbul university hospitals. So I think this is very important. No money, even one single penny is asked from them. So this is important. And daily basis, we are taking care of more than 500 patients as Kimse Yok Mu in the region. And also, this is basically what we are doing actually. And also there are some injured people also. Blast injuries and some trauma cases, basically what we are confronting, so we are taking care of them as well. And last year, my university, Istanbul Metin University in Istanbul, made a collaboration with the Syrian doctors in the United States, actually. So we organized a meeting about the Syrian refugees, what we can do for them. So it was actually a very good occasion to discuss the issue with them in the aspect of medical area, actually. Briefly, this is what we are doing to the Syrian refugees in Turkey. And additionally, I just briefly mention about what we are doing in Africa as Kimse Yok Mu. Kimse Yok Mu is giving medical services for a couple of years in Africa, in many countries in Africa, from Somalia to Kenya, Ethiopia to Democratic Republic of Congo. There are several countries we are giving, medical services there. In particular, actually, in Somalia, it's a very tragedy after the drought problem in 2011. So I've been there a couple of times, and I worked in the refugee camps there. So we took care of the patients, and we did surgeries, small surgeries in the camps, and also I worked in the local hospitals. So actually another tragedy is in Somalia. As you know, for 20 years there was no official government in Somalia. So recently, they try to, make the system there. So as Kimse Yok Mu, in a couple of months, we are going to open our first teaching hospital in Mogadishu. So it's going to be the most modern hospital in Mogadishu. So besides giving medical services to the public, we will also educate the medical people, like the training hospital. So also my university in Istanbul has a memorandum of understanding with a university in Mogadishu. So we are training the residents from Mogadishu. Now currently I have 2 residents from Mogadishu that they are working with us in Istanbul. So I think briefly I can mention all this, and I wish that the tragedy in Syria will end soon, and people live in peace as soon as possible. Thank you very much for your attention.
Now the floor is open to your questions. Sir, gentleman in the back there.
First of all, it's on. It's just for the camera, so it's on. Okay. Well, first of all, I'm Anjihad Kadur. I'm president of Syria Relief and Development. I'd like to thank the distinguished speaker and your organization for the helping. Our organization really working inside Syria, except we have one hospital in Jordan, working in medical relief as well. I'd like to ask a few questions. First of all, the impact of Rihaniya on the Syrian people, because we heard a lot of sad story, destroying the car. If you have some about that one. And then my question, really, the main question is, are you working inside Syria? Any work inside Syria? And what's your program in medical aid and education aid for the Syrian, especially inside Syria? And if you can just identify some challenging issue that you are facing working to help Syria.
First of all, when that happened, we were in USA. Only I learned something through media, and what we learned is Assad people, let's say, they organize this, and so our feelings to our guests from Syria is the same, because we know that you said fitna, somebody is trying to do something, so we know this. So our feelings is the same to our Syrian guest in Turkey. Nothing changed, but of course this is a kind of attempt to give damage to this good relationship between the Turkish people and the Syrian people. But hopefully, inshallah, it won't work. It won't work. And inside Syria, what we did, we sent food, mainly flour, to make bread, because we had a campaign all together with Turkish government and Turkish NGOs before winter. That was the motto of the common campaign. Winter came, one bread, one blanket for Syrians. So that was the name of our campaign. So we organized a campaign like that, and we sent flour to make bread in Syria, also in Turkey side as well. There are some other NGOs who are very active in Syrian side, but we are very active in Turkey side. So I can say this. And about medical aid, we have some Syrian doctors. I didn't mention about this. Sometimes because to finish the presentation on time, you can't find the time to share everything. So we have a clinic in Kilis. We have Syrian doctors and medical staff because of the language problem, because Turkish doctors can't speak Arabic, so there will be communication problem. So there are some Syrian medical staff in Kilis. So we are supporting them by giving free medicines and medical equipments, what they need. So this is what we are doing in medical area. And in educational area, in Gaziantep, in Kilis, again, we open like learning center here, okay, for the kids and for the parents as well. For the kids, there are so many Syrian teachers. They are following Syrian curriculum in this learning center. But after that, we add additionally Turkish language to have communication. And also for the parents, we are inviting them. And more than 1,000 students in Kilis, more than 1,000 students in Gaziantep we have about educational aids, let me say. Thank you.
Next. Metin Bey, do you want to comment on any particular challenges? Our guest had asked that at the end of his question. Yeah.
Providing aid to Syrian, whether out
Any
or
particular challenges at the moment?
Particular challenges, I don't know what to say. But our desire is hopefully this problem will finish as soon as possible in a short period of time. And then because now really our funds are from Turkish people. And we organize so many campaigns in Turkey. And we organize a campaign for Haiti earthquake. After that, flood disaster in Pakistan. After that, drought problem in Somalia. And then one earthquake in Turkey. Now Syrian problem. So really Turkish people are tired of making donations. We discuss in our meetings with other NGOs this issue. So we are praying for finishing this problem. So this is very important. Yeah.
So the only, donor is the private donors, or as well the government, Turkish government as well, donating to you. And how many in your camp from Syria right now? Is it 200,000, you say?
Yeah.
In your camp, right? Or just you are subsidizing?
200,000 Syrians are in governmental camps, and Turkish government is supporting those people in the governmental camp. Out of the governmental camps, there are another 200,000 Syrians. And Turkish NGOs, as Kimse Yok Mu and the other Turkish NGOs, we are supporting, we are trying to find some solution, the other 200,000. But we have problem in this area. We don't have problem in this area because Turkish government doing very well to those 200,000.
I'm talking about the 200,000 that out of the government. How many you are subsidizing of those? Your organization.
Yeah, I can say that around 80,000 we are supporting, mainly in Kilis. In Kilis. Our main activity is in Kilis, but also we are some aids in Reyhanlı, in Hatay, in Yaylada, and the other towns in that area. By the way, Turkish government is supporting the camps. The rest, our source of fund is Turkish people, not the government. So we are NGO, non-governmental. So just Turkish people are supporting our campaigns, and we are sharing what we have with the Syrian guests in Turkey.
Next question, please.
My name is Hazami Barmada, and I'm working with Syrian Relief and Development. My question to you is, do you guys have partnerships with any Syrian American organizations or Syrian regional organizations? And is that something that you're looking to establish? And then my second part of that question was, are you guys looking to scale up your work inside Syria and how could one establish a partnership with your organization?
First of all, in my last visit, I met with SAMS, Syrian American Medical Society, and Dr. Zahir Sehlul. Yeah, I met with him, and we mentioned about the problem and to work together. And also, I visit so many Syrians in different cities, and also I shared what we are doing to our Syrian guests in Turkey. But we didn't have any common project until now. So inside Syria, again, as I mentioned, we are just 9 years old, like a young child. So our source is limited, not huge amount of sources. So what we have is not enough to find some solutions the Syrian guests in Turkey. So, but again, we send some foods inside Syria, but our main focus is Gaziantep, Kilis, Yaylada, Hatay, in those areas, mainly in Kilis. And in Kilis, by the way, let me share this. In Kilis, we have so many volunteers, and we shared street by street. If one family come from Syria to Kilis, we know this, and we are trying to find solution in Kilis. We are very active in Kilis. So street by street, we know the list. So we have responsible volunteers for each street. So because we have very good relationship with Syrian guests in those areas, if some new family come to that area, immediately we know who came, what is the need, etc. So in Kilis we are very active. In Gaziantep we are very active. Hatay, Yaylada, so and so. The rest, again, we share with some other Turkish NGOs. We are very active here. Some other NGOs are very active in Reyhanlı, and there are some Turkish NGOs. They are very active in Syrian side. Yeah.
Do you have your
Yeah.
Next question. Well, I'll ask one from the floor. I think on behalf of maybe some of the people here that know less about the situation, can you comment at all about the social fragmentation of your Syrian guests? They're probably uprooted from neighbors and close community and are mixing in new combinations with their own people. There must be some interesting dynamics socially.
Yeah. From the media, what we learn, there are some wedding ceremonies between Turkish people and Syrian people. Yeah. So this is really, I'm very happy because they are our guests and they are living in Turkey right now. So I like these wedding ceremonies. So.
Are you finding that Syrian guests from different parts of Syria are suddenly kind of discovering each other, almost like a cultural exchange or something like that? I mean, is there?
Yeah. Also, we are in our Gaziantep branch and Kilis branch. Also, we are helping them to find some job. Also, this is very important. Otherwise, what they have, they spend their money and they have nothing right now. So we were expecting, actually our Turkish government was expecting to finish this problem in a short period of time, but unfortunately it didn't finish. So, so you have limited source, you spend your money to rent, to food, and you finish your money. So what you will do? So now you need job. So also I want to share this. For example, in United States, I think without a work permit, nobody can work. Is it?
Yes.
Yeah. In Turkey also it is the same. But we have only one exceptional case, our Syrian guest. Because in our meeting with the governmental people, we shared this with the governmental side. Okay, what they will do? They spend their money, they have no money, and they need food, they need to buy something. So, and they need to work. So, and then they said that, okay, after our meeting with the Turkish government, they said that they will close their eyes to Syrian guests in Turkey. So they are opening their eyes to Turkish people, but they are closing their eyes to Syrian guests in Turkey when they found some people who work without working permit. So really, Turkish government really did their best. Also did arrange everything for Syrian guests in Turkey.
This lady in the front, please.
Hi, thank you very much. I was just wondering if you could comment a little bit about some of the other NGOs you said that are active in Turkey that work with Syrians, either inside or in Turkey. Do they work in fields other than the provision of basic social services like food, shelter, clothing? I mean, are there NGOs that work with Syrian activists or in different fields, to your knowledge?
Can you introduce yourself briefly?
I'm sorry, hi. My name is Pelin. I'm actually a native of Turkey, and I work at Freedom House.
Okay, thank you. Actually, after the earthquake in 1999, we have a lot of NGOs in Turkey. But before 1999, we have a tradition. Of course, Turkish people were making donations. But maybe you know the tradition. If you donate with your right hands, don't show to your left hand. That was the tradition at that time. So it was secret thing when you donate something. But after the earthquake in 1999, we understood that this is very valuable for us. Okay, this is something on this side. But on the other side, to encourage the people to make donations, we must do something. And then so many NGOs established after 1999. So many different mentality people organize some NGOs. So they like to go this way. Some other NGOs like to go this way, like that. So we have some NGOs, because in our meeting with the governmental side, so many NGOs participate to those meetings. They shared what they did. So some of the NGOs are doing their best in Syria. I heard that they are distributing foods, bread, etc., blanket, tent in Syria, inside Syria. But in Turkey side also, so many Turkish NGOs also trying to do their best. But again, in the United States, maybe you have a lot of NGOs in hundreds years old, 50 years old. But I'm mentioning about 1999, after 1999. So we are just 9 years old. Maybe we have some 10 years, 15 years old NGOs. So our sources are limited. This is what I mean. But according to our sources, really we are doing our best. We are doing our best.
Sir in back.
Hi, my name is Joe Livingston with Department of State's Bureau of Population, Refugees, and Migration. My question is with respect to your coordination with other NGOs, but more particularly with IOs, particularly UNHCR, UNICEF, UNFPA, other organizations that are heavily present in Turkey. We provide a significant amount of funding, I think now over $43 million since the beginning of the conflict to those UN organizations alone. I'd like to get a better sense of how you coordinate with those organizations and how you see your coordination in the future shaping out, whether there will be partnerships, whether you see yourself as an implementing partner for the work that other organizations are doing, and how you conduct your needs assessment to determine where you're best serving unmet needs and how that sort of gets facilitated between those other actors.
Yeah. First of all, we have very good relation with U.S. Embassy in Turkey and USAID in Turkey and UNHCR in Turkey. Sometimes we organize a common project with UNHCR with some refugees from different countries, because when they come to Istanbul, they need some clothing, they need some medicine, etc. So we have good relation, very good relation with UNHCR, US Embassy, and USAID. But again, if I say this is perfect relation, no. But we started, at least we started to establish a good relationship. Just before I came here, USAID representative in Turkey, she visited our head office in Istanbul. So to discuss what to do. The same day I came here, but my colleagues had a meeting with her. So I can say that we are on the right way about this issue, but I can say that we have perfect relationship with UNHCR, USAID, etc., etc. But we are very hopeful for the future. At least we started to establish a good relationship. And also, there was an earthquake 2 years ago in Turkey. For example, American Embassy chose us, Kimse Yok Mu, to give donation to the earthquake victims. So this is also very valuable for us. Let me share this with you also. Mr. Jimmy Carter, he learned about our aid activities in Sudan, Darfur, about what Kimse Yok Mu is doing in Sudan, Darfur. And then he sent his Europe countries advisor to Turkey to bring his gift to us and to show his appreciation to us. So this is also very, very valuable for us. Yeah.
Other question? I actually have one. I understand you have some affiliations with some charitable groups in the United States. Maybe this group would like to hear about that.
Actually, we have some Turkish Americans here in New Jersey and Houston. There are 2 NGOs. Also, they are our sister organizations, and sometimes they support our campaigns, and sometimes we support their campaigns. For example, after Sandy storm, also we donate $100,000 US, and we send this money to Helping Hands in New Jersey, and we organize something together with Helping Hands in New Jersey.
Other questions? No? Sir.
Hi, my name is Brendan McNamara, and one just basic question I was wondering is who exactly make up the bulk of the Syrian refugees in Turkey? Is it just a cross-section of like Syrian society, or does it favor more like one geographical region or like ethnic group or one sort? So could you shed any light on that?
Let me understand exactly.
Can you repeat that?
Yeah, sure. Just basically wondering who makes up the bulk of the Syrian refugees in Turkey. So are they all like from certain cities in Syria? Is it more like an urban or rural population, or is it certain like ethnic groups that are more likely to go to Turkey than others? I'm just wondering if there's any demographic information you could share.
Actually, I don't know exactly. I don't know exactly. Tam olarak anladın mı? Let me understand.
Belli bir kesimden mi geliyor insanlar, yoksa bütün Suriye toplumu temsil mi ediliyor gelen?
Türkiye'ye gelenler.
Belli etnik gruplardan mı, dini gruplar, yani profillerini soruyor gelen kişiler?
No, just Syrian citizens from everywhere, from different ethnic backgrounds. So again, they came to Turkey and they went to the other countries just to survive. This is the idea, because they are bombing. Assad is bombing the villages, the towns, cities. So they may die at any times. So they are taking the family members and trying to find a place which they can survive. So that was the idea. So to Turkey, we have a lot of guests from Syria from different ethnic backgrounds. For example, in Yaylada, Turkish origin Syrians. We have a lot of Turkish origin Syrians. They can speak Turkish, for example. In Kilis, Syrians, just Syrians, not Turkish origin Syrian, but just Syrians, for example. So, from different ethnic background, we have a lot of Syrian guests in Turkey. Thank you.
We have a question over here from our Syrian friend.
Can I elaborate on that question?
Yeah, please.
Because most of, guests, I call them guests, not refugee, the guest went to Turkey from, started from Idlib area because it was the most affected and the closest to Turkey. And then Aleppo came to the picture. So most of our, guests from those area, few from Hama area as well, the urban, the suburb of Hama, especially the northwest, and some are from the south of Latakia as well. So those are the most affected, because the other like Homs, most of the refugees went to Lebanon, Tripoli, and other area, and the south went to Jordan as well. So looks like most of and part of Al-Raqqa went to also to those, especially Kallis area, because it's so close to Al-Raqqa and Deir ez-Zor. So this is the demographic of refugees of Syria. The south region went to Jordan, the middle region, especially Damascus and Homs, went to Lebanon, and then the northern and eastern side went to Turkey. That's kind of roughly, just to give you an idea.
All right, thank you.
Thank you very much for that. Are there any more questions? Well, if there aren't, I want to thank very much Dr. Atesh and Metin Bey. It's really been a very enlightening presentation, and we all wish you well.
Thank you.
We know how important this work is in a human framework. Thank you very much.
Thank you. We have video presentation if you have time in the other room, I think.